Hi everyone, myself Sahana K. Shetty, medical student studying in USM KLE, Belgium. Today I have chosen the topic caffeine and you. The reason why I have chosen because I drink a lot of coffee, so I was wondering how that might affect my health. This inspired me to do some research on the subject. It's something in which I have an interest and something I have researched thoroughly and therefore know something about it. Today, I would like to give you some of the facts about caffeine and effects on your body. I may not cause you to change your coffee consumption, but at least you will be better informed about what you are putting into your body. I'm going to talk about the advantages, disadvantages of the caffeine, and how to overcome the caffeine addiction, and discuss what are considered to be safe levels of caffeine consumption. Let's start first. So let's start with the introduction about caffeine. Caffeine, which comes from the leaves, seeds, and fruits of about 63 different plant species, and it is well known as the stimulant for central nervous system. And caffeine is bitter, white, crystalline purine. It is a drug from the class methylxanthine alkaloid and is chemically related to the adenine and guanine base. So we consume caffeine in our daily life, like it will be in tea, coffee, chocolates, or cola, medications, or even energy bars. So next, the FDA recommends that healthy adults limit their caffeine intake to maximum of 400 milligrams a day. It means it can be equal to 4 to 5 cups of coffee. The amount of caffeine included in some common food and beverages are, like in cola it will be 30 to 40 milligram, in coffee it will be 80 to 100 milligram, and so on. There are many advantages and disadvantages associated with the intake of caffeine. So let us discuss the advantages. So the first advantage is boost energy levels. um, we start our day with morning coffee. It gives us a sense of adrenaline in the morning, and studies have shown that increased dopamine levels, which then fuels our addiction to feel happy. So next is improve physical performance. Caffeine stimulates the central nervous system as it is stimulant, to reduce the fatigue and drowsiness. It may also benefit exercise performance and even increase muscular strength. So it improves the physical performance. So next is it is very beneficial for the liver. It is beneficial for the liver because it secretes a chemical called as paraxanthine that slows the growth of the scar tissue involved in the fibrosis. Due to this, there are many diseases which can be helped to fight back, like liver cancer, alcohol related issues, or cirrhosis of liver, or fatty liver diseases, even a hepatitis C. So next is a reduced depression. As we know, it is a caffeine is a stimulant. So we can call caffeine as an antidepressant. Also, it acts by elevating serotonin and dopamine to reduce the depression. So next is the prevent gout. So the caffeine is thought to reduce the gout risk by lowering the uric acid levels. There are two ways where the caffeine reduces uric acid levels. Uh, One is by increasing the rate that our body excretes uric acid by excreting uric acid, and one more, it acts as the enzyme that break down purines in the body. Means when there will be breaking of the purines in our body, then there will be low uric acid production. So by two mechanisms it prevents gout formation. Next, can aid in the weight loss. So caffeine may reduce feelings of hunger and a desire to eat a brief time. Calories burning due to this. Then caffeine appears to increase energy use even when we are at rest. It stimulates thermogenesis, means one way our body generates heat and energy from digested food. So next is coffee can lower risk of diabetes. This is because the coffee contains three compounds, which are like caffeine acid, and chlorogenic acid. These three compounds play a vital role in decreasing the risk of type 2 diabetes, especially. These compounds will block the toxic accumulations of a protein linked with an increased risk of type 2 diabetes. So next is help cleanse the stomach. Coffee or a caffeine, we know it is a diuretic. So does it make us want to urinate often? So that is why when we drink black coffee without sugar, all the toxins and bacteria flushed out easily in the form of urine. This helps to clean our stomach. So next is a reduce risk of cancer. The mechanism behind this is still unknown, but orally, or it is not yet proven, but we can say that it reduces the risk of cancer. Next, prevents onset of disease such as Alzheimer and Parkinson's. Like, we can say that because it is a stimulant for central nervous system, and both Alzheimer's and Parkinson's disease are neurodegenerative diseases. It is the mechanism is still unknown. So next, let us discuss about disadvantages related to caffeine. So first one is addiction. So if the person is drinking daily about 100 gram of sorry if the person is if the person's intake is 100 milligram of caffeine, then the person may be addicted to the caffeine. Means he can feel that physical dependence on caffeine. Then he can come up with withdrawal symptoms like headache, muscle pain, stiffness, lethargy, nausea, vomiting, depressed mood, and so on. So next is the indigestion. When a caffeine intake is too high, the muscle that connects the stomach to the esophagus is relaxed. When this happens, an opening is created from stomach to esophagus. So the acid rushes into esophagus and creates an acid reflux. So in this, there will be more production of acid and there will be indigestion. Next is insomnia. So it is known that we drink coffee to keep ourselves awake, and while driving also we drink a coffee so that we should be alert, and we drink a coffee during day to keep ourselves alert. While it is important to note that caffeine coffee cannot replace a sleep, it can temporarily make us feel more alert by blocking sleep inducing chemicals in brain and increase adrenaline production. So next is incontinence. So caffeine increases bladder activity and result in exacerbated symptoms like urgency and frequency for urination and even incontinence, reducing or okay, incontinence. Next is the risk of heart attack. Caffeine in high doses rises our blood level. Then in pure forms, if we can say, then epinephrine can be increased in blood pressure, then increase the contractility of force of the heart, and there will be increase in the heart rate. Next, gout attack that we have discussed. I have seen in the advantages. When we take excessive caffeine intake, then there will be the opposite mechanism occurring. So next is the headache. Since caffeine narrows the blood vessels that surrounds our brain, so when we try to when we skip drinking the caffeine contained foods, then there will be headache causing, because due to narrowing of blood vessels during that, it will cause a pain. So lastly, in females especially, caffeine may alter hormone profiles and thus affect menstrual functions. Menstrual dysfunction in turn may be related to other health outcomes such as reduced fertility, miscarriage, worsened menopause symptoms, and so on. So next, how to overcome sorry, these are the caffeine overdoses. These are these are the common symptoms or what we can experience, that all I have discussed. And next is how to overcome the caffeine addiction. There are few steps. One is cutting back gradually. They keep like we can do, like we can keep tabs on our overall caffeine intake consumption. The first step to breaking the cycle of caffeine addiction is to identify how much we are consuming. Then we can go on reducing it day by day. We can set a goal for ourselves to reduce the caffeine consumption. Look, and we can even look behind like contents of the drink, so that we can look for a hidden source of a caffeine, how much content is present in the cola, and also on. So next is as adjusting your daily day-to-day life. That is, we can drink a green tea or opt for decaf, or we can try even herbal supplements for our extra energy. Examples are ashwagandha, lion man's mushroom, then wild oats seeds, and so on. And even we can find a substitute for our favorite caffeinated beverages also, so that we can adjust our day to day life. Next is managing withdrawal symptoms. So when we start quitting the caffeine, there will be withdrawal symptoms appearing. So to manage that, we can take a pain relievers, and even we should not reduce it so fastly that even we can't manage the withdrawal symptoms. We should reduce it so little amount, and then we can continue reducing it. Should have patience. We should be always hydrated, and if there is uncontrolled pain, then we can take a pain relievers. Then next is the caffeine with the water. When we drink a caffeine with the water, then there will be reduced intake of caffeine alkaloid. So this can also help to overcome caffeine addiction. And one more note is, we should not stop suddenly the intake of caffeine, because it may lead to severe withdrawal symptoms. And we can replace a small amount of regular coffee with decaf coffee, because decaffeinated cola and soft drinks contain no caffeine, but decaffeinated coffee is not caffeine free. Little bit caffeine will be there, but not too much that can harm our health. That's all from me. Thank you.